Last time we talked about the arteries present within the gluteal region. Today we shall be starting with the arteries present and supplying the posterior compartment of the thigh. So let's start with the profunda femoris. Profunda femoris is also called deep artery of the thigh. So here in this diagram on the right side of the slide, you can see the profunda femoris, also called the femoral of the thigh, and its location. Origin, it arises from the femoral artery soon after the femoral artery enters the thigh. So it is almost the proximal most branch of the femoral artery, given high up superiorly within the thigh. Regarding its course, it continues to run down. Here in this diagram, you can see that it continues to run down, being closer to femur bone, more closer to femur bone than the femoral artery itself. And then it continues to run down between the two muscles, pectineus and adductor longus, and keeps running down on the posterior side of the adductor longus. It almost never leaves the region of the thigh. The branches that are given off by the deep femoral artery include lateral circumflex femoral artery, medial circumflex femoral artery, and the perforating arteries. Now let's talk about perforating arteries. Perforating arteries, they arise from the deep artery, deep femoral artery. They are 4 in number, out of which 3 perforating arteries are given off by the deep femoral artery within the anterior compartment of the thigh, whereas the 4th one is actually the terminal branch and the continuation of the deep femoral artery. You must note down some peculiar points regarding the arrangement of these arteries. These perforating arteries are large vessels having transverse and intercompartmental course. Intercompartmental का मतलब है कि ये एक compartment से दूसरे compartment में enter होती हैं. So they run between the different compartments of the thigh. How do they enter the posterior compartment? They are going to pierce the aponeurotic distal attachment of the adductor magnus to enter the posterior compartment of the thigh. The branches given off by the perforating arteries include the muscular branches to the hamstrings or the muscles present within the posterior compartment of the thigh. And they also give rise to anastomotic branches that participate in the anastomosis superiorly and inferiorly. Superiorly with the inferior gluteal artery, and inferiorly they anastomose with the branches from the popliteal artery. So in this way, they form an anastomotic network that extends from the gluteal region above up till the popliteal region below. So this was all about the arteries of the posterior compartment of thigh. As a doctor, you must remember that surgeons, they are required to identify the location of the perforating arteries before they move on to perform surgeries in the region of the thigh. They have to save the perforating arteries from some injuries that may occur to them during the operations. Perforating arteries how do they terminate? They pierce the lateral intermuscular septum after supplying the posterior compartment of the thigh, and they enter the anterior compartment of the thigh by piercing the lateral intermuscular septum to supply the vastus lateralis muscle. So this was all about the arteries of the posterior compartment of the thigh. Now let's talk about veins of the gluteal region as well as posterior compartment of the thigh. Gluteal veins, they include superior gluteal vein and inferior gluteal vein. And these veins, they accompany as a general rule, they accompany the arteries of the same vein. These gluteal veins, they are the tributaries of the internal iliac veins that drain the blood from the gluteal region. Here you can see inferior vena cava. The structure shown in the gray is abdominal aorta. Inferior vena cava can be shown receiving the common iliac veins on both sides of the body, right and left, common iliac veins. So gluteal veins are tributaries of the internal iliac veins. Here you can see in the yellow, internal iliac vein is highlighted. The gluteal veins, they also communicate with the femoral vein. This communication is important in case femoral vein is occluded or has to be ligated. So the blood will have an alternative route via gluteal veins into the internal iliac vein. Then we have internal pudendal vein that is also present in the region of the gluteal region, but we know that it does not drain the structures from the gluteal region. Rather, it is the major vessel of the perineum, that is the region of the external genitalia. So, internal pudendal vein also accompanies the internal pudendal arteries and enters the internal iliac vein. So far, we have seen that gluteal veins and internal pudendal vein are tributaries of which vein? Internal iliac vein. Perforating veins, they accompany the arteries of the same name as a rule. Every medical student knows this rule so far. And they drain the blood from the posterior compartment of the thigh into the deep vein of the thigh. And perforating veins, just like their counterparts in the arteries, they communicate superiorly and inferiorly with the popliteal vein and inferior gluteal veins. So I hope this very simple topic is clear to all of you. So this was all about the vessels of the gluteal region as well as posterior compartment of the thigh. Often this topic is asked within the university examinations, especially in the form of a draw and label question.